So we're at Morehouse School of Medicine, and today we have Brooke Bisbee, who is the president of the American Podiatric Medical Association, and we have Megan McClelland, who is also our executive director of the American Podiatric Medical Association, and also Lawrence Burns out of Texas.
Out of Tennessee,
Tennessee,
Nashville, by way of
Nashville.
Chicago.
There you go, by the way of Chicago, and with the National Medical Association. And we're just going to talk about some of the major issues going on with podiatry in that space, and also being down here at Morehouse School of Medicine, where we have interventional cardiologists. We have, I think, every specialty that lower extremity peripheral arterial disease impacts here. And it's showcasing the showing of bloodlines, which is with Dr. Fakaridi out of Mississippi, with, again, peripheral arterial disease and the devastating amputations that go on. So I'll kind of pass it on. Brooke,
Okay.
as
Thank
far
you.
as some of the, you travel a lot. I said
A
that.
lot.
I mean, good gracious, you just got in today. You'll be traveling probably again tomorrow. A lot of office time. You're not in the office. But what are a lot of the things when you're going to the States that you're speaking about, letting them know that APMA is taking care of them and that we're in a good position?
Right. So advocacy is a huge part of what we do at APMA. And specific to this event, especially, is our advocacy for diabetic therapeutic shoes. It's a benefit that patients can get through the Medicare program. And unfortunately, over the years, we've seen a huge decline in the number of patients that get those shoes. And that then in turn, we see an increase in ulcers and amputations and things like that. And the problem comes down to paperwork. It's paperwork over patients, and we're trying to reverse that and make it patients over paperwork. So that's a huge piece of legislation that we have right now in Congress that we're working on.
Wonderful, wonderful. And I know, Megan, you, since we're just go down the line here, you're like her travel buddy.
Yeah.
So
we haven't gotten in any trouble. We haven't
good,
been arrested
good.
yet.
I haven't seen you on the news, so that's a good thing. But Megan, some of the things that you've seen, and what I really like is you being a new executive director with American Podiatric Medical Association, and you building bridges with the National Medical Association, with you building bridges with the American Heart Association. Has that been easy for you? Tell us how you kind of go through that, especially coming out of a hospital system and now working with an organization like APMA.
Yeah, so it's been amazing working with the American Podiatric Medical Association, but more amazing in kind of seeing the work that we do collectively, not only within the podiatric medical world, but with these other subspecialties and groups we work with. And one of the things I was really, Dr. Bisbee and I were really excited about as we were engaging with the National Medical Association and the podiatric section there was what a focus they were doing on the lower extremity diabetic wound care, which is such a huge part of the work that podiatry does and podiatric medicine does. So the partnerships and being able to kind of bring that work together with Dr. Burns and others has really been really meaningful. And I think we have an opportunity with Dr. Mitchell at the lead at NMA right now, with this being one of his focuses. And just quite frankly, when I advocate on Capitol Hill for the work that we do, this is the work that resonates. Everybody knows somebody who has diabetes or has had impacts from diabetes. And many more people who have been impacted by loss of limbs than most people realize and things like that. So when we can make sure that the world knows more about all the great work we're doing in this area and that we're partnering with groups outside of podiatry, it's like the whole care continuum with Dr. Fakaridi and the cardiologists and other folks. This is a whole person type of thing. And the podiatry group is part of that as well. And we really do save limbs, and lives in that process. So it's been super exciting. I think the more we've talked with these groups, the more that people are wanting to interact with one another. And it's going to be a lot more that we can do in the future with one another. So it's been great. And we're really excited to be here this evening because this Bloodlines Mississippi documentary, if you all haven't seen it, it will change your life and the idea of how we need to deal with this care, not only for all populations, but particularly communities of color are being vastly more impacted by this, and that we need to make changes in that as we move forward. So I'm just excited for tonight's events.
See, that's why I love Megan, because she teased me up. I tell you what.
Yes.
And that was the thing that I wanted to mention and have Dr. Burns speak on, because earlier today we were in the state capitol, and we had everyone there. And I think the National Medical Association has done a superb job in getting all the players together. I mean, from legislators to industry to physicians. And again, when I say physicians, everyone's playing on the same level, on the same playing field. And I've never heard that many physicians patting each other on the back on what each one does and how important it is to work together to solve this problem. So if you could kind of go into how you all, made that bridge with the National Medical Association through the National Podiatric Medical Association, and then you also, are in the you're an academic as well, not
Yes,
just
I
a
was
podiatric
going to
surgeon.
say
So
that
kind of going into that as well.
I have a little history. Been doing this over 40 years. I taught at Show College. We were approached in the 80s, believe it or not. Larry Harkless and a number of others approached us and said, look, primary care is too busy. They don't have time to take the shoes and socks off. They don't palpate the pulses. You as podiatrists do that on a regular basis. We want you guys to do arterial Doppler testing. This is back in the 80s. I've been doing it since then. So I'm excited about the ARC Act, the Amputation Reduction Act. And here in Georgia, the House has passed it. It's up to the Senate. In Illinois, it's been passed by the governor and the Senate and the House there. So we're excited that this is going to continue. I actually had the opportunity to meet Dr. Fakaridi years ago. We and Meharry were talking about doing a rural residency program in the Delta of Mississippi. So I went down to Clarksdale, went down to Batesville, and I scoped it out. And I thought my residents were going to be in trouble. They're like, we want you to teach them about diabetic foot because they're going to get down to the Delta and not have a clue what to do. So monthly, I give them lectures and help prepare them. And when I went down, I was shocked because in Batesville, they have a small hospital and they have a podiatrist or two that comes all the way from Oxford, Mississippi. And believe it or not, in that little town, they have hyperbaric oxygen chamber.
Wow.
Meharry Medical School,
Wow.
Vanderbilt Medical School, no hyperbaric oxygen chambers. So I'm happy for the evolution. I'm happy to have witnessed it. And podiatry, American Podiatric Medical Association, has a rare opportunity to shine because we're the keepers of the foot. As someone said early, we find cardiac problems before they happen because if you have abnormal flow into the foot, we anticipate you have it in the coronary arteries. So when we take an x-ray and I see the calcification on the x-ray, you're going to get an arterial Doppler. If it's abnormal, I'm forwarding you to vascular and then also cardiac. And this is how we're going to solve this problem. We're going to reduce the amputation rate by working together, cohesiveness, whereas for years, physicians have worked in silos. I take care of the eye, I take care of the this or that. No, we have to all come together and work for the unity and the progress of the patient.
Absolutely. It's stop working in silos. And again, I love working with the National Medical Association. I want to thank Dr. Jefferson, for the president of the National Medical Association, for allowing us to use this platform, as well as Dr. Adrienne Atkins-Sneed, who I've had many long conversations with her on a weekly basis. So I think this will continue to go and it'll continue to grow and we'll continue to save limbs, and through that we'll continue to save lives.
Great.
And thanks for everybody for being on the panel.
Thanks
Thank
for
you.
having us.
Thank you.